presentation, please come forward so we can get started. Transformation. يلا. مين اللي حكى بدي اعمل transformation؟ Transduction, conjugation. يلا let's go.
نحن الثانيين نحن نحكي عن transaction أو شيء transformation.
Let's go ahead.
Let's go ahead. Okay.
Go ahead.
Occur between bacteria of the same or co-related species. نفس species بس أو co-related مش هو transcription occurs when DNA is transferred from one cell to another by bacteriophage cell. طريقة الترانزكشن الجينات تنتقل بس عن طريق bacteriophage يؤخذ عن عبارة عن فيروس. احنا الفيروسز هي عبارة عن duplicate parasites. بس أول إحنا نعرف كيف يدخل الفيروس كيف ندخل الجينات البكتيريا المعدية. لما تدخل الجينات البكتيريا تبعت الفيروس جوا البكتيريا يكون عندها تو باثويز. كيف تعرف؟ مول باثويز يدخل يا إما أول باثويز اللايزوجين باثوي أو اللايزوجين. أنا بسميهم سايلنت واللايزوجين. يعني تفوت الجينوم تبع الفيروس يندمج مع الجينوم تبع البكتيريا. وبس خلص هذا ما بيشي. كم البكتيريا على تنقسم كمية هاي. هذه البكتيريا ممكن يمر فيها هي اللايجيك بكتيريا. هي عبارة عن إنه خلص هي الفيشن هيفوت مش هيندمج هيندمج الجينوم تبع البكتيريا ويخرج يتكاثر الفيروس يعمل فيروسز يعمل عدد الفيروس جوا البكتيريا وبعدين تصير فيروسز البكتيريا تنتج وتطلع فيروسز من جوا. بس السؤال هو how the transaction work كيف يصير النشر يعني الفيروس تتكاثر جوا. هو فعليا كيف تدخل الجينات من بكتيريا ثانية. هو جوا قاعد يتكاثر الجينيتيك ماتيريال تبعت الفيروس قاعد تتكاثر ممكن بالغلط ياخذ من الجينوم تبع البكتيريا هو قاعد ياخذ من الجينوم تبع الفيروس. فبصير خلص هو يجرب الجينوم تبع البكتيريا جوا الفيروس وبعدين يتكاثر بعدين تنتشر بس الفيروسات تطلع من البكتيريا بتكون من ضمنها الجينوم تبع الفيروس وهيك هي تنقل من الفيروس هذا نوع البكتيريا ثانية وتنقل الجينوم تبعه اللي من ضمنه الجينوم تبع البكتيريا. In the two kinds of transaction, generalized and specialized. That's not generalized هي إنه bacteriophage أو virus ممكن ينقل أي جينات بيها كده يعني هو يتكاثر جوا البكتيريا ممكن يشوف أي جين عنده هيدرولايز من الجينات البكتيريا تصير هيدروليسيس تتكسر وتروح في كل مكان جوا البكتيريا ممكن هو يتكاثر يمسك أي جين هذا يحط جواته وينقل. specialized تنقل جينات معينة فقط. بس يعني حتى الميكانيزم تبعه كان شوي معقد من امبارح بس هو ما بينقل اي جين بس في استشفاء في جين معين من البكتيريا بينقله من البكتيريا الثانية. بس في سؤال امبارح كمان يطيله خرج في بالي انه البكتيريا keep taking genes from other bacteria do their genomes keep getting larger and larger. الأخ جينوم يزيد يعني إذا ما له نهاية. الجواب هو لا إنه إذا الترانسفير بس حسب الترانسفير جين ما بعطي شيء مميز. تعملوا ديليشن وخلص ما تستفيد من ديليشن وتطلعوا. هي جينوم سايز المين كونسبت اوفر تايم بضل جينوم كثير بضل ثابت. الجينات بتفوتها مش مفيده، تعملها ديليشن تخلص منها وتطلع. وبس هسه الصور دي عن كيف
هلا الكلينيكال ابلكيشنز للفيج بكتيريوفيجز هلا قدروا تو ساينتست ب 2014 انه يعالج يستفيدوا من الفيج ثيرابي بانهم يتخلصوا من البكتيريا ريزيستنس. فمن خلال انه نحن نقدر نعدل بلازما من خلال الجين انجينيرنج نقدر نفوت على البكتيريوفيجز والبكتيريا بشكل عام. هاي التكنيك نقدر نعدل جينز نحن بنياهم. طبعا هلا بيكون في سؤال انه اذا نحن بدنا نفوت على الجسم البشري اي فيج ثيرابي يعني اي فيج ميديسن يكون في بكتيريوفيجز فيروسز. هلا احنا هذول الفيروسز اللي نحطهم يتكاثروا باللا نهايه، يعني نحن نعرف انه الفيروسز بيقدروا يتكاثروا من خلال خليه واحده بيقدر يصير hundreds of thousands of viruses. So هذا الشيء ما بصير ليش؟ لانه نحن عندنا هايبر بيخلوا البكتيريوفيج يوقف عند ستيج معين ما يتكاثر ابدا. هلا السؤال الثاني هو انه البكتيريا ريزيستنس اذا نحن بدنا نلغي البكتيريا ريزيستنس من خلال هاي الميكانيزم، هل انه ممكن يصير في عندنا من خلال السبلايسنج تكنيكس اللي بتصير بالبكتيريا يصير في عندنا نيو جنريشن اوف بكتيريا ريزيستنس؟ برضه هذا السؤال بده يعمل عليه ريسيرش كثير. هو لسه ما في one answer لانه اليوكاريوتس كثير بتختلف عن البروكاريوتس. مع العلم انه نحن نقدر نعمل فيج ثيرابي مع البروكاريوتس and eukaryotic cells، بس نحن ما نقدر نعملهم غير بالبروكاريوتك سيلز. لحتى هلا ما نقدر نفوت فيج ثيرابي على الهيومنز. ليش؟ لانه نحن لسه ما نعرف كيف تاثيره على البروكاريوتس.
شو اسمه؟
انا سوار.
طيب حاطينك. طيب هلا سوار and Rama did an excellent job. They literally went above and beyond. فازقفوا لهم. In brief, in one sentence, transduction means transfer of a genetic material from one microorganism to another using the virus. The virus normally infects human and also it infects any living system, including bacteria. Bacteria to a virus is a giant. صح؟ Virus is very tiny compared to a. الله يسكر هالباب. In summary, viruses do not possess replicative machinery. Okay? So without a viable host, it's nothing. They can do nothing. They're not even alive. So when they go in and hijack host replicative machinery and they start replicating, they take up some DNA from the host and they go infect another cell and they exchange that genetic material. That's in summary. But what Rama and Siwar did is an excellent job. But for the sake of time, I just need like 2 more minutes at transformation transaction so we can keep going. Are you next? بدك اياه بس brief بس define it. That's it.
السلام عليكم. concept of virus factors مع بعض نعمل كومبينيشن. نلاحظ مثلا البكتيريا كجينوم لو نعمل ريبليكيشن عن طريق باينفيشن الجينوم بتاعها بيطلع كومبيست. كيف نلاحظ ان في بكتيريا لا بصير الجينوم بتاعها يختلف.
تعال محمد.
الجينوم كان عندها ريسك فاكتورز، الجينوم بطل عندها ريسك فاكتورز، الجينوم كان عندها فايروس فاكتورز، الجينوم صار عندها فايروس فاكتورز او بالعكس كله بصير.
نعم.
ايش اللي صار؟ كيف؟ بصير اكسترا كروموسوم فهاي تكون اوتونوموس يعني فيها تعمل ريبليكيشن بدون اي تدخل بالكروموسوم.
So transformation as a definition is just transformation. شو definition؟ تحكي conjugation ولا transformation؟ conjugation. Okay.
conjugation as a definition. يعني definition اللي هي عباره عن شيء يسموها بالبيولوجي intimate process. between bacteria transfer genes. هاي الجينز تفيدها بالسيرفايفل عشان تساعد البكتيريا.
مش necessarily. Thank you. Excellent. شو اسمك؟ أمجد. Thank you أمجد. زدت ولا أمجد؟ مين اللي بده يحكي على transformation؟ He's not here, huh? طيب. So thank you أمجد. Thank you سوار. Thank you يا راما. اللي بدي إياه منكم تعرفوا definition بس. اللي بيحب يعني يتعمق بالموضوع be my guest. When a transduction involves a bacterial phage, a virus that infects one cell, takes up some of its genome, and then when it goes and infects another cell, it transfers that genomic material. واضح؟ بالعربي واضح؟ طيب. Transformation is the bacterial system takes up free-floating DNA that doesn't belong to anybody, that possibly was the product of cell that died or something. تمام؟ So picking up free-floating DNA. Conjugation مثل ما شرحها أمجد, it is a direct cell-to-cell contact in which a transformation of a plasmid occurs. That plasmid مثل ما أمجد حكى, it could possess an advantageous property, at the same time it could possess a disadvantageous property. For the sake of medical education, بنحكي transferring a resistant gene. But 99.9% of the time, it could also mean a determinant sequelae for the bacteria and the death of the bacteria by transferring unwanted genes that doesn't fit with the overall genome of the bacteria and it dies and lyses. Okay? فمش دائما transformation, transduction, and conjugation means something good. It happens anyways, and it happens haphazardly, بشكل عشوائي and completely random. Few far and between, they gain an advantageous function that makes them more virulent and more resistant to antimicrobial agents. واضح شو بحكي؟ طيب. So yesterday we started talking about bacterial meningitis. We finished today, inshallah, and then we defined it, we outlined it, we've talked about what is meningitis, and we actually defined it, and then we gave you a take-home in which you're supposed to know what is aseptic meningitis syndrome, and we all agreed the most common type of meningitis is the viral-caused infections. We talked about the epidemiology, and this is true for any disease, the value, the importance. We talked about the meningitis belt in Africa, and then we've discussed the microbiology part of the business. We've talked about different ones and the value of the various vaccines that they were introduced along the way and how they significantly reduce the incidence of meningitis from that causative agent. We list out the agents and how they change throughout time. We've talked about the age group and the relation to the immune status and how a bug can or cannot be a successful microbial agent in establishing that infection. And here's the slide where it actually shows you the various ages and the other predisposing conditions that puts you at a disadvantage, including breaking up the physical barrier, such as head trauma and neurosurgery. We talked about Haemophilus influenza and the thumb sign in the X-ray. صح? The emergency condition in which we said you do not use a tongue depressor, otherwise you would kill that child. And we are not in the business of doing so. We're in the business of saving lives and making lives better. We talked about Neisseria meningitis, strep pneumoniae, in which there are 9 known serotypes. Currently, it's PCV20, and probably in our lifetime, probably reach to 50 or 90, okay? Because that's the void. Whenever you clear up some of the bugs, others will come in and fill that space. And that's the name of the game, okay? We are in, on, and swimming in an ocean of microorganisms that we cannot see. And that's a blessing, alhamdulillah. Imagine if you can see all the bugs around you, in you, and on you. Right. Listeria, group B streptococci, and the intraparentum antibiotic if you are in a planned pregnancy, and the gram-negative bacilli, staph aureus, and epidermidis. And then we stopped here, okay? And we said, I asked you actually to look into the red box where the fight occurs inside the meninges, and then we'll go through it, and then we'll discuss it, inshallah, and we'll keep on with the slides. So here in the red box, initially there ought to be a colonization of some sort. Landing of the bug in the nasopharyngeal colonization is one of the possible scenarios, okay? And then it would, like any other bug, it would establish a colony, attach, it colonize, and then it disseminates. Again, one of the major highways for dissemination is the bloodstream. Another is the lymphatic, another is the interstitium. Check. So here, after local invasion to the surrounding tissue in the nasopharyngeal area, assuming it's not treated, assuming weakened immune system, someone at risk, less than 2, above 60, yani geriatric age population, then you will end up with a successful bacteremia. Bacteremia, yani bacteria in the blood. مش هيك? And that's normally a bad news. That's normally the patient will be very septic, ill-looking. And then eventually, if the bacteria is successful to evade the host immune responses, such as phagocytosis, opsonization, complement attack complexes, okay, it will eventually cross the blood-brain barrier, اللي هو يعني the last resort of defense for the central nervous system, and it gets in. Once it gets in, it replicates in the subarachnoid space, releases its toxins and LPSs, and that's where there will be a response from the host. And most often, our issue with infections is not the infection itself, it's trying to control the immune response to that infection. Okay? Then normally, if the bacteria incites a huge immune response, for example, it dumps out a lot of toxins and LPSs all of a sudden, فبيكون very strong immune response. That very strong immune response, it damages the host tissues, tight junctions, membranes, بصير oozing of interstitial fluids. زي ما انتم شايفين in the algorithm, there would be also subsequently to that, from the cytokine, macrophages, neutrophil, there will be increase of the permeability of blood-brain barrier. That's number one. There will be vasculitis, and there will be the inflammation, which is increasing the CSF outflow resistance, leading to increase in the intracranial pressure. Hence, the headache. مش بصير عندهم headache? Increase in the intracranial pressure. So as a result, at the bottom here, you're looking at vasogenic edema, increase in the intracranial pressure, and infarction and other types of intracranial edema. Ultimately, it would lead to the decreased cerebral blood flow, loss of cerebrovascular autoregulation. شو triad of anyone with meningitis walking into your clinic? Fever is one, صح؟ احكي stiff neck, fever, headache, and the triad, loss of mental status, change in the mental status بشكل عام يعني. Okay? So that's the story. Here, if we zoom in into the molecular mechanisms of bacterial meningitis, you can see there are different guns, if you will, that strep pneumonia. And here we're using the two big ones, right? اللي هم the most common cause infection between age of 2 to 50. مش هيك؟ strep pneumonia and Neisseria meningitis. Do you agree? But if you look at it, you'll see that they deploy pneumonia capsule and other antigens, as well Neisseria meningitis capsule and other antigens, with the quest of what? Avoiding the opsonization, phagocytosis, and complement-mediated membrane attack complex that will be disadvantaging the bug and kill it, okay? So that's the story. So here you see several interactions with the complement, classical pathway, and the alternative pathway. And if the bug is successful enough, it will cross either through the cell or between the cells. These are two different mechanisms. وفي كمان the Trojan horse mechanism, okay, in which it hides inside a macrophage or a lymphocyte, and it goes with the lymphocyte or macrophage into the crossing into the blood-brain barrier. بنسميها Trojan horse mechanism, okay? So through the cell, between the cells, or other means to get successfully crossing the blood-brain barrier and then colonizing all over again in the subarachnoid space, causing the inflammation that we just outlined in the algorithm. واضح كلامي؟ حدا مش فاهم؟ طيب شطوري. So, as I said, I am not about memorization, but I want you to correlate with this, make the names familiar, يعني sounds familiar, لأنه على الأغلب your exams are MCQ, and for your own sake and knowledge and understanding, you would want to read through these tables. I don't want you to memorize it, but read through it so you will understand what are the bacterial factors that contributes to the virulence and the successful establishment of a meningitis, okay? And at the same time, what are the factors that the host plays in return trying to deter, to defend the human body? Fimbiri, capsule, and other factors that we've mentioned along the way, and what are the things that the host is doing trying to combat that? Okay, so the Fimbiri, as you know, it's important for adhesion and attachment to establish the colonization. طيب. What else? What about IgA and IgG? Antibodies that are naturally circulating in the blood, trying to defend. One of the host evasion mechanism or host immune evasion mechanism that Neisseria meningitis does, كاتب highlighted here. Okay, it literally binds to IgA, okay, preventing preferential binding and blocking the benefits of IgA and IgM. يعني these rather beneficial antibodies that would normally bind to other bacterial infections, for meningitis, it will preferentially bind to it, prevent and inhibits its function, يعني deactivating it. So that's one mechanism. Another mechanism, as I said, through the blood-brain barrier, from the bloodstream, يعني from bacteremia into crossing the blood-brain barrier, capsule comes in place. ممكن أسألكم, what's the process or the function of the capsule? It resists the alternative or the classical complement mediated, the classical. So this could be an exam question, okay? So the capsule resists the classical complement mediated attack and destroying this. And thereby, some mechanisms are deployed from the host, such as the C3, the alternative complement. انتوا خدتوا complement, صح? So the alternative complement in this case will be deployed to combat the capsulated microorganism. So in summary, capsulated will evade the classical pathway and they will be caught with the alternative C3-mediated complement pathway. So these are information, they're tiny little information, molecular pathogenesis, good to know and good for the exam, okay? This is the blood-brain barrier and its normal function in microenvironment regulation and protection against invaders. طيب, as I said, intra or intercellular or transcellular or leukocyte facilitated mechanism or the non-hematogenous route اللي ما حكيت عنه اللي هو through the cranial nerves. Okay, so intercellular, transcellular, Trojan horse mechanism, and the last one اللي هو ايش؟ non-hematogenous route through the cranial nerve routes. So these, again, little tips, very easy to memorize, and rather important for the exam and for your understanding, okay? So this is how a successful bacterial meningitis can be established. These are the routes to cross the blood-brain barrier. So you would want to know those, okay, for the test. طيب, تمام. Tight junctions, and as I said, the Trojan horse mechanism is another one. طيب. At the end, scientists researched and really wanted to understand how much of bacteria is enough to cross the blood-brain barrier and to establish a successful meningitis. Okay, what's the secret? What's the combination? How can we avoid this? How can we learn? And it's a mystery بصراحة. Okay, we don't really know the exact mechanism and what are the clinical things that we can intervene to prevent a bug from successfully crossing a rather highly protected blood-brain barrier. Okay, they found after numerous studies. ليش متأخرة؟ ليش متأخرة؟ نعم؟ لا ماشي مش متعتذريش بس احكي لي ليش متأخرة؟ ها؟ ليش؟ ما سمعتش ليش متأخرة؟ أهلا وسهلا، أنت مش متأخرة يعني. أهلا وسهلا، تفضلي. طيب. أوكي. لما واحد يسألكوا سؤال جاوبوا السؤال عادي. The best answer is I don't know. طيب. شو كنا نحكي؟ blood brain barrier مش هيك؟ فthey found هاي النقطة المهمة إنه sustained bacteremia. You can take this to the bank, okay? Sustained bacteremia is the key, okay? More than 6 hours. Some mice studies found in more than 6 hours of bacteremia, okay? يعني بتيجي your wife and telling you he is sick, he is feverish, and then, oh, it's okay, let's wait for tomorrow, okay? And normally the story starts with a nasopharyngeal infection. فمشان هيك احنا we shouldn't wait for a sick fever, for a very ill child with fever. We should rather act on this rather quickly, okay? To suspect and to play doctor and say, oh, he may be just a flu, etc. And then it turned out to be actually a bacterial infection. And then you wait it out, and then you enable the bug not only to colonize the nasopharynx, but also to get into the blood, establishing bacteremia, and then it's there for a long period of time. Over time, it will debilitate your blood-brain barrier protective mechanisms and successfully go through the different routes that we mentioned. We've mentioned 4 different routes, مش هيك؟ شو هما؟ What are the 4 different routes? Through the cell, in between the cells, Trojan horse, and through the cranial nerve route, non-hematogenous route. واضح؟ واضح الكلام؟ فدائما we ask this question. If someone comes in with a fever, do you really give them antibiotic prophylactically? Or you wait out and say, well, probably this is a viral infection. You give or you don't give. You give or you don't give. هذا السؤال دائما موجود. دائما. You go to the pharmacist or you go to the doctor. بالأردن بروحوا على الفارماسيست أكثر. تمام؟ What do you do? So there are certain criteria, okay? If it walks like a flu, then it's most likely a flu. Then probably there is no need for an antibiotic at that stage. مش هيك؟ You give him supportive therapy for a viral infection, for a flu. اللي انتم كلكم بتعرفوه مش هيك؟ Fluids or rest of vitamin C, for example. صح؟ Or some antiviral medications available. But if he's really toxic looking and the fever is not going down, تعطي انت fever medication and it's not going down, the child is sick, he's not eating, he's not playing, he's not going to the bathroom, he's really toxic looking, he's really sick. Then you take them to the hospital, they do the C-reactive protein, they look into certain parameters that indicate inflammation, such as CRP, and then accordingly, and some white blood cell differential, and the neutrophil is high, then most likely it is a bacterial infection. At that point, we take a sample for culture and susceptibility for the lab, and we give what we call prophylactic antibiotic treatment. واضح الكلام؟ And this is how we play the game. يعني and this is how we prevent a sustained bacteremia that if neglected would lead to rather serious sequelae اللي هو today's talk meningitis. مش هيك؟ meningitis مسحة يعني؟ لا. طيب good. So that's the story, and I hope you remember what we've discussed about whether or not we give antibiotic. لأنه إحنا at the same time, what I mentioned yesterday about antibiotic stewardship is a rather important concept that we have to enforce, and we have to work with other healthcare team and workers and pharma to prevent the emergence of the next super drug resistant microorganism. Okay? That's the story. So, believe it or not, passing the blood-brain barrier, okay, the job of the bug is rather easy moving onward from there, okay? Because the lack of inflammatory or lack of immune arsenal in the CSF. So the CSF doesn't have all the essential things that you would want like in the blood for other considerations. For other reasons, the CSF have a limited or inadequate capacity of immune responses as in the blood. That's why, subhanallah, the blood-brain barrier. Check. So you have the blood and all the immune responses in the blood, and then you have a rather highly protected blood-brain barrier. لأنه CSF have limited capacity to fight off infections. وهذا can be an exam question. Okay? واضح? طيب. So once you get there and you end up with a subarachnoid inflammation, you are looking, unfortunately, into the increased intracranial pressure, edema, and nerve damage. Okay? And زي ما بنعرف nerve cells regenerate ولا they don't regenerate? They do not. Okay. So as I said, the cerebral edema comes in many flavors: vasogenic, cytotoxic, and interstitial. These are the three types that I want you to understand and correlate with for the exam. Okay? So this is another hint and flavor for the molecular pathogenesis of bacterial meningitis. شو؟ Good? Bad? Ugly? كويس؟ مش كويس؟ حدا مش فاهم؟ خلصنا احنا. حدا مش فاهم؟ ما خلصناش امزح معك. طيب. So what are the signs and symptoms of bacterial meningitis? As you all said, and it's showing in the image, there are various signs. Signs يعني تخيل واحد عمره شهرين يجي يحكي لك راسي مصدع والله يا بابا اعطيني سيجاره مثلا او cigarette. It's not going to happen, right? So for a less than 2-year-old child, you're looking for crying consistently, lethargy, and bulging of the anterior fontanelle. متى بتسكر الانتيريور fontanelle؟ طيب good يعني ماشي ما بتعرفوا. And the posterior fontanelle? Okay, so it closes earlier than the anterior fontanelle. شو وظيفة الفونتانيلز طيب؟ ليش في fontanelles؟ To pass through the vaginal canal, the birth canal. مش هيك؟ شو بصير شو اسمهم السكال؟ ناس sutures. احسنتم ناسيها. طيب good. So all in all, if for a child who come in and they are less than 2 years old, they're not sleeping, they're not feeding, they're not passing stool. These are the three. And this is true for everything, not only for meningitis. It's true for all infections. Are they eating? Are they sleeping? Are they passing stool? From 1 to 4, we're looking for other manifestations. For 1 to 4, you're looking at fever, vomiting, headache, etc. And for adults, you're looking for the TIRAD, fever, headache, and change in the mental status. صح? In terms of percentages, you can see the percentages here and how it's correlates. All the way to papilledema. You know how to test for papilledema? Test for papilledema. How do we test for papilledema? Did any of you look up aseptic bacterial meningitis syndrome? عفوا aseptic meningitis syndrome yesterday. حدا بيحب يجاوب؟ أنا مش قلت لكم look up aseptic meningitis syndrome؟ صح؟ Did any of you look it up؟ صراحة احكوا معي بصراحة. طب أحكي لكم شغلة. To become a successful clinician, you're here, you like it or not, صح? You're in it to hopefully graduate and become a successful clinician. Check. If you don't have the passion, you don't have the tenacity and the consistency every day toward fulfilling your career ambition, becoming a successful clinician, my advice to you is to look for something else that you enjoy. عرفتوا؟ أنا بحكي معكم بكل شفافية ومسجل كمان. But always follow your passion in life. في كثير دكاترة وفي كثير people in healthcare profession. So I advise you to follow your passion. If this is not in for you, you may want to consider other professions. Okay? أنا بحكي معكم ناصح أمين يعني. Okay? So please look up aseptic meningitis syndrome and look up how to test for papilledema. Okay? هلا papilledema is rather serious sign. We only see it when there is a significant increase in what? Intracranial pressure. What is the difference between a sign and a symptom? Huh? And the symptom? Yes, excellent. So the symptom is what the patient say, and the sign is what you detect with your expert eyes and gentle touch. ماشي؟ ماشي. Kerning and Berditsky signs are used in clinician to elicit meningeal irritation. I put the slide out here. You will thank me when you're in clinical years for your fun and enjoyment. I will not be testing you عليهم, okay? But this is for you to understand how we test for someone with irritated meninges, inflamed meninges. واضح? And this is true for both. It's true for viral infection and it's true for bacterial infection. Then what are you testing here? You're testing the inflammation. هلا احنا قلنا all infections will necessarily have inflammation, but not all inflammations will have infection. يعني ممكن تكون autoimmune وعنده positive sign, okay? It could be viral, it could be bacterial, it could be anything that leads to inflammation of the meninges. Is that clear? في pathogen specific findings. I will give you two, only two. ماشي؟ واحدة على الراش that is pathognomonic. سامعين pathognomonic before? Characteristic of Neisseria meningitis. This, what you're looking at here in the image, is the erythematous and macular that quickly evolve into patchy phase and coalesce and become into purpuric form. These are with Neisseria meningitis. The other thing is with Listeria monocytogenes, you're looking at more frequency of seizures. Okay? فكيف بدنا نعرف? From history taking, we ask where were they traveling to France or to a place in which they tried exotic foods and pasteurized cheeses, or the consumption of contaminated coleslaw, for example. Okay? Things that we normally use as a buzz, as a keyword in your exams. Okay? And then you see more seizure, and then we may give you another hint, and then you would know the most commonly pathogen in this case is the Listeria monocytogenes. For example, I could mention they are vaccinated for the Haemophilus and the Strep pneumoniae vaccines. Okay? So you can exclude those. For example, okay? So this is pathogen-specific finding. And then the important thing is CSF analysis. So in order to understand CSF analysis, you ought to know what is normal CSF, what does it contain, and how it's differ from bacterial to viral. Today, I just want you to know the difference between a bacterial CSF and a viral CSF. Can you see the difference on the table, on the slide? You can see mononuclear versus neutrophilic. بشكل عام, neutrophils are associated with bacterial infection. طيب, glucose count will be high or low? they're less than 40, so they're lower than that of a viral because the bacteria is using the circulating CSF glucose as food source. واضح؟ بتلاقوا طبعا this is one of the theories. We don't know exactly why the glucose count less than 40 wherein viral is more than 45. شايفين الديفرنس؟ ما بنعرف ليش. But one of the theories of the hypothesis إنه the bacteria uses the available glucose as an energy source. Makes sense. It makes it easier for you to understand and memorize. And the last piece is the protein. Proteins are much higher in bacterial infection, where in viral they're less than 200. In bacteria can go up to 500 because the bacterial structures that are frequently dumped into the CSF, you would expect to see more protein content with the bacterial infection. So I just want you to know these three. Is that easy? So neutrophil versus lymphocyte. Lymphocyte مع viral infection. Neutrophil مع bacterial infection. Glucose concentration is higher in viral infection, and the protein concentration is lower in viral infection. Where the bacteria takes up glucose, the glucose concentration is lower, and it dumps out a lot of structures and proteins, so the protein concentration is higher. If you go through this logic, it might be accurate 100%, but it helps us understand the three main differences in the CSF analysis, okay? Now, if we zoom into the typical CSF finding in patients with bacterial meningitis, you can look at the different parameters that pertains a most likely positive culture of a bacteria. Okay, so that's the story. But before we get to this story, when do we tap? Do you tap or you don't tap? Is there a risk for spinal tap? Patient with suspected bacterial meningitis. شو الريسك of spinal tap؟ يعني trying to منين بنجيب الCSF احنا؟ L3, 4, L4, L5, you insert this big needle into someone's spinal column. You are running the risk of what? ها؟ عبيدات شو الريسك بكون؟ نحط إبرة بظهر واحد، شو الريسك بصير؟ damage of the nerves، صح؟ أحسنت. infection، صح؟ أحسنت. leakage، صح؟ صح، أحسنت. bleeding، صح؟ شايفين ما اشتغل العبيدات؟ 4 different highly risk. ومش بس هيك، you know the fifth risk اللي هو هذا يعني أسوأ شيء؟ the handling. إنه in expert hands and they want to perform a tab just because they're medical students and they just want to learn how to do it, and they rush through it without proper supervision, and it's really disastrous sequelae for the patient. صح ولا لا؟ You agree or disagree? But thereby, we have an algorithm that you can follow to see which people constitute or deserve to be tapped. شو يعني deserve؟ يعني the risk outweighs the benefit or لا. يعني do we really need to tap this patient ولا لا؟ خلاص نبين meningitis, let's go ahead and treat. That's the idea, مش هيك؟ But this is the algorithm, okay, of suspicion of bacterial meningitis with the various components in which we do yes for bacterial culture, and then we give treatment and then here at the end, the CT negative, that's when we perform lumbar puncture. The general rule of thumb, if you agree with me, do we avoid tap or we encourage tap? We avoid tap, صح? To minimize risk and malpractice lawsuit against you. مش هيك؟ صح ولا لا؟ واضح حكي؟ So general rule of thumb, we would want to avoid tapping into the CSF as much as possible because of the risks that are associated with this rather risky procedure, مش هيك؟ And that's why we follow a protocol وراح تشوفوا in different schools, in different healthcare system, whether it's in the Middle East, Northern American, or European, they have guidelines whether or not you should tap someone, okay, and draw cerebral spinal fluid. واضح؟ It's a risky procedure. فما بتنعملش لأي بني آدم. Okay, good. So I encourage you, if you have the passion and desire to become a good clinician, just walk yourself through the algorithm, okay? Diagnosis. The gold standard is culture of the CSF. If we end up tapping. Otherwise, molecular testing and diagnosis, أنا بحكي لكم this as a microbiologist, we are moving from traditional antimicrobial testing and susceptibility اللي هو الكالتشر والجرام ستين واللي بتعرفوه والMICs. We are moving to more molecular advanced techniques in which PCR is now looked after as one of the good indicators for diagnosis. So if you are in doubt and there is a PCR in the answer key, normally choose PCR, okay? Back to culture with chocolate or blood agar, you can see the big three players in today's talk, bacterial meningitis, and how would they look like on gram stain and whether or not they grow on chocolate and blood agar. CAP is chocolate, agar plate, and BAB, blood agar plate. And they're gram-negative diplococci, positive diplococci, and gram-negative pleomorphic cocobacilli. شو يعني pleomorphic؟ شو يعني pleomorphic على السريع؟ الشكل مش متغير يعني مش ثابت. Different shapes. Okay. Treatment. As you can see كمان, the treatment varies with age and risk factors. ليش in the blue jacket? What do you think? ليش the treatment تختلف حسب العمر؟ شو رأيك؟ ما بتعرف؟ guess أي guess؟ يعني هل إحنا بنعالج الصغير زي الكبير with antibiotics؟ لا صح؟ تفضل عزام. So the type of bacterial infection is one, but assuming يا عزام you've already identified the bug, برضه الانتيبيوتيك that you give لازم تراعي side effects مش هيك؟ For newborn, growing, ما بنعطيهم something that is harsh, have lots of side effects, unlike adults مش هيك؟ So there are differences, and the differences are laid out in the table for your entertainment and enjoyment, okay? And perhaps at some point in year 4 or 5 or 6, you'll go back to my slides and open it up and look how we treat. Another debatable topic in the field اللي هو do you give or you don't give corticosteroid and when? Okay? So, number one, why do we give corticosteroid to people with meningitis? شو بيعمل corticosteroid؟ عزام يلا. بيهدي الاميون سيستم. زي ما حكيت لكم, the immune system is our biggest fear. A strong immune response damages the tissues rather than taking care of the problem, okay? In fact, some microbes use this as a host evasion mechanism. تمام? So when we give steroids, we calm down the immune system, okay? Reduces the tissue necrotic factor levels, the leukocytosis, the concentration of glucose, lactate, and proteins. And these parameters, when they improve, and then you give your antibiotic, okay, the results and the outcome is much better. واضح؟ تمام. So the guidelines dictates as such throughout. زي ما حكيت لكم, adjuvant dexamethasone therapy results in significant decrease in the leukocytosis, TNF-alpha, and improvement in the glucose, lactate, and protein. So I can simply ask you this on the exam. هاي أول paragraph here. I can easily ask you this, and we all agree, وهون بالأردن it's practiced. We give dexamethasone, okay? So I can easily ask you what is the advantages, and here there are 3 different advantages you can list out. Is that clear? Okay, and then we're talking about the guidelines in Europe and North America, and that's for your own knowledge. Prevention, obviously, زي ما حكيت لكم yesterday and today, we're in the business of making lives better and save lives. To do so, we are a biggest advocate of preventive medicine, مش هيك? So prevention, prevention, prevention. Prevention, obviously, زي ما فرجتكم بالepidemiological data, using the available vaccines can help reduce the risk of infection significantly. So we don't have to worry about the infection from the beginning, such as موسم الحج. الناس they want to go for pilgrimage, a high concentration of people in a limited area, geographical area, and thereby we give the Neisseria meningitis vaccine as pneumonia, and the Haemophilus influenza is routinely now given وزارة الصحة للأطفال. تمام? And the BCG as well for tuberculosis. Okay, so that's prevention. البروفيلاكسيس اللي هو تحمي نفسك from close contact, household members, and of course the first line healthcare providers احنا وإياكم, the one who are brave enough to be in the hospital where all the superbugs are flourishing. مش هيك؟ Us, the healthcare workers, for prevention. So this is prevention and this is prophylaxis to prevent انتشار مرض السحايا بالعربي. طيب, good. Complication. One of the famous complications of acute bacterial meningitis is hearing loss. And in fact, أي طفل بصير عنده سحايا, one of the things اللي بنحكي للأهالي to get their ears tested. واضح? Obviously, because of the neuronal damage, increase in the cranial pressure, the edema, the cerebral edema, you are expected seizure, limb weakness, difficulty in vision, speech, language, memory, communication, as well as overall IQ and acuity, mental acuity, okay? Listed out here for you. Subhanallah, that's why the brain is protected with a skull, with a blood-brain barrier. مش هيك؟ طيب. So I would like to thank you for your patience. I hope you enjoyed the meningitis. What are you looking at here in the image? With the hat. شو شايف بالimage? لابس الطاقية. Yes sir. شو شايف؟ بكتيريا يا عيني عليك. شو وضعها؟ What's the blue? What's the yellow? The pili, the fimbriae, that uses Neisseria meningitis for attachment. The blue is the bug, and these are tentacles to reach out and attach and successfully colonize. صح? Questions? Thank you, everyone.